is a viral hemorrhagic illness, and it could span a period of 2 to 21 days once a person is infected. It can be contracted from infected feces or urine of rodents. Let's take a walk down memory lane all the way to the northern part of Nigeria to a town called Lassa. In 1969, 2 missionary nurses contracted this ailment in that town called Lassa, and they were diagnosed with a fever, and that fever came to be known as Lassa fever. The eventuality was a fatality. But from then up till now, knowledge and research has progressed about this disease called Lassa fever. And that's our topic today on the program, Wellness and Living. You're welcome. My name is Thelma Obaze. DJ Palmer opines that preservation of health is easier than the curing of disease. And we tend to agree. It tells us that there are measures we can put in place that can keep ailments and disease at bay if we do them consistently and correctly. In the course of the program, we will examine some of these areas with our medical professional, Dr. Ebuta. But first up, you know how we like to do? We go to town so we can talk with you, so we can share in your experiences. We get to know what you know, and we get to share again with everyone what you share. Let's do that as usual.
Yeah, I heard about Lassa fever, and the little I know about Lassa fever is basically caused by rats, like rat urine or excrete, especially in like gari. Some of this our raw food. I know Nigeria now, poverty. Yes. Even if your gari is being messed up by rats, urine or anything, you still want to use it and manage it. You still want to see if the Lassa thing is true or false.
Long before little children. Very dangerous disease.
Yes, I have heard about Lassa fever. So it's caused by dirty environments, especially rats.
Lava is a kind of malaria parasite or something. I don't really understand the full meaning, but the only way someone can prevent it is by keeping the environment clean. Not allowing rats based on your food or any food that you have. You just keep it covered. At least avoid rat any environment that you have. Because any food, rats they are within it definitely. That's one of the major causes of Lassa fever.
When you are not keeping your environment clean, there's the possibility of rodents, which is the rats, coming into your room or into your store to contaminate your foodstuff like gari, beans or rice. When it is contaminated, when you cook such food, you are bound to have Lassa fever. Once there is a disease doesn't know a child, doesn't know a woman, doesn't know a man, it will consume every person. So long as you have blood flowing in your vein, then it will be difficult for you to be saying that it will only kill or affect children or women.
It's to keep our environment clean, to avoid rats coming to our living homes to infect us with Lassa fever.
How to avoid this Lassa fever is just the way we store our food. Let's be very, very conscious of the way we store our food. And let's try at all means to eradicate rats, because it's not even healthy to be in our house or anywhere. So let's just try in one way or the other to eradicate rats. And if maybe the way you try or your try is not enough, maybe rats get to spoil one or two things, please just avoid it.
Is to imbibe an effective sanitation program in our homes. We should always try and keep our environment clean, and also we should kill all rodents, rats that are in our neighborhood, because they are the carriers of this Lassa fever. The one with the long mouth is very, very, it's poisonous. So when we see it in our environment, we should just kill it, eliminate it. And I will call on the authorities to also help by fumigating our environment. Fumigation is very, very important. It's key to a healthful living.
Measures we've taken according to our doctor is making sure your environment is clean. They don't allow rats into your facilities or surroundings. At the same time, it's contagious. So anybody that have any symptom of malaria, instead of just putting a drop into the very should go to hospital go for a full test to ascertain kind of sickness that person is having.
Bruce Daddy says, let's build wellness rather than treating disease. That's something everyone will agree with. And I have no doubt about that. We present the best version of ourselves when we are well, when we are healthy. Then we can set goals and objectives, and we can prepare. We can take actions. We can take measurements to achieve them. First, what do we do to preserve our good health? Lassa fever is our focus today. We did some research. We're bringing for you some information, vital and critical information, especially as we have come to learn that human beings can contract Lassa fever very easily, just by ignoring hygiene at any phase or step in our daily life. It could happen to anyone or everyone. Let's take those measures. And we're best prepared to take those measures when we have the best, well-researched and documented information. Lassa fever has been known to occur in different parts of Nigeria, and it can affect anyone, any gender at any time. There have been several Lassa fever outbreaks since it was first reported in 1969. Lassa fever presents with no specific symptoms. That is why clinical diagnosis is often difficult, especially at the onset of the disease. Accurate diagnosis, therefore, can be assisted with laboratory testing, clinical manifestations, and epidemiological findings. Early treatment is very critical for survival, and it requires a specialized and segmented type of treatment. Care must be taken to avoid the spread of the disease, especially in a hospital setting. Lassa fever is symptomatic and is characterized by fever, pain in the muscles, nausea, vomiting, sore throat, abdominal, and chest pains. After the initial symptoms are noticed, Lassa fever progresses to include hemorrhaging and neurological problems. If treatment is not meted out early, fatalities may and often occur. So far, 5,000 deaths have been recorded annually in West Africa since Lassa fever was discovered. Lassa fever can be controlled effectively by adopting proper standard precautions in hospitals as well as communities. It is essential to educate the public on the transmission mode. It is also vital and critical to emphasize the need for proper hygiene in the home and in the environment. There should be proper sanitation in the home and in the surroundings to avoid Lassa fever and keep it at bay. Lassa fever can and must be eradicated. To achieve this, all hands, that of the medical professionals and the society at large, must be on deck to eradicate it and to bring about a lasting and permanent solution. One could say that Every experience that we encounter in our life's journey can be quite interesting when we think that either at this very point we're experiencing it, somebody is going through the same thing, or in the past, or someone will go through the same thing in the future. That makes it easier and less daunting for you to surmount ailments, challenges, difficulties, hurdles, obstacles, call them whatever. It is possible to get treatment at every given time, especially if you know what you are ailing from. When the diet is not right, medicine is of no use. And when the diet is correct, medicine is of no need. So true, wouldn't you say? So vital, too easy to go along. Take precautions to ensure that you preserve your health. Take every measure necessary to ensure that your wellness state continues to progress upwards. Dr. Ebuka is talking to us about Lassa fever. Let's take a listen.
Lassa fever is an infection that results following exposure to the Lassa fever virus. And it's basically a condition that was first discovered in 1969 when two missionary nurses died in northeastern Nigeria, precisely Lassa, Borno State, from where it got its name, the Lassa fever. However, it's a condition that is quite endemic across the West African sub-region, affecting countries like Sierra Leone, Liberia, and of course, our dear country, Nigeria. Every year, as much as 200 to 300,000 people are affected across the sub-region, and death rates are between 5,000 to 10,000. It's so common in some places that in Liberia, for example, out of every 10 patients on admission on the bed in the hospital, one of them is likely to be infected with the Lassa fever virus. So it's a problem, it's a major health problem, and is presently an epidemic in the country as a result of an increase in the incident. Lassa fever follows exposure, obviously, to the feces, urine, or other forms of contaminated materials and other body fluids from contaminated sources. And usually it follows the exposure of a patient either to another patient who has this condition, or exposure to a certain form of rat called the African rat, precisely Mastomyces nataliensis, that contaminates food materials and by passing stool and urine around the house, and people who access those materials can get infected. Commonly, within 2 to 21 days following the infection with Lassa fever, patients would manifest with certain symptoms, and these symptoms appear and are progressive all the way to the bad ones. So initially, patients will present with fever, weakness, and a feeling of unwell, which we call malaise. After a couple of days, patients will then progress to develop nausea, vomiting, abdominal pain, and may even have diarrhea. In addition to that, they will complain of chest pain, joint pains, muscle pain, affecting all parts of the body. It's important to know that this first set of symptoms are common in most patients. However, it may suddenly resolve. A small percentage, about 20%, may progress beyond that to the classical symptoms like bleeding from the mucosa. So it will come from the eye, from the nose, even from the mouth. And then if patients go to toilet to pass stool, they may notice some blood. And for ladies who are menstruating, they may notice that the flow is more, or may just notice an intermenstrual bleed, bleeding from the genital area that is outside their normal menses. Usually you want to see bleeding from two sides to solidify or confirm or to strengthen your suspicion. If, for example, 100 patients are exposed and infected with Lassa fever today, in the course of a couple of weeks or days to weeks, within 2 weeks, about 80 of them will develop only mild symptoms and may not even go to the hospital. They may suspect that they have malaria or typhoid or any of the other mild conditions or even viral flu. The remaining 20% get ill enough to seek medical care. And out of this 20% that end up in the hospital, in an epidemic situation like we have now, you would have a case fatality of as much as 50%. So 10 out of 20 who present to the hospital are at risk of dying. Every suspected case should be properly reported, properly isolated, and confirmed using the reference labs. And treatment is usually involves a medication which I believe the Federal Ministry of Health has made available, and its early initiation of treatment is associated with better outcomes. Patients who are more at risk are those who have come in contact with the rat. So you have farmers who go to the farm and come in contact with rats, people who dry their wares like farm wares like groundnut, cocoa, cassava, pellets, yam, cut-ups beside the road. People who come in contact with maybe garbage that have been assessed by rats to a large extent. Then again, health workers who are the receiving end, who are in hospitals and come in contact with this patient. The symptoms of Lassa fever mirror common infections we experience every day, like malaria, like typhoid, like acute gastroenteritis, and other viral hemorrhagic fevers like Ebola. Prevention can be looked upon at several levels. Health education is very key to increase community awareness so that everybody is aware that if you have a fever, if you have some of the symptoms that we earlier stated, you should make effort to contact a health personnel and get proper advice. Provision of personal protective equipment to a large extent will protect the health workers who are the receiving end in the hospitals when these patients present. Then a strengthening of the confirmatory process where you strengthen the network of sample delivery to reference lab for quick confirmation of suspected cases will allow the early introduction and use of the medication, which has been shown to be potent in treating patients who are suspected with Lassa fever. The other interventions like general hygiene, hand hygiene, personal hygiene, household hygiene, and using rodent-proof materials and disposing your waste in a proper way that would prevent access to rodents. Lassa fever is endemic. It's been with us for several years, first discovered in 1969. Nigeria has fought conclusively a similar virus, Ebola virus. I think we have the critical mass of health personnel, the management capacity, and the wherewithal, and I believe also the political will to come together to ensure that this does not lead to a bigger challenge for our health system.
While we're doing our research about Lassa fever and carrying out interviews so we could be more informed and share that information with you, we also multitasked. We thought we'd do something different with our fitness. Let's go play golf. And guess what Ben Hogan says about golf? He said golf is a game of misses. The man who misses the most is going to win. And that's what we found when we went out on the course.
I'm in a group of 4. I'm playing with 3 gentlemen. So a typical round of golf, it's over 18 holes. And right now we're on hole 10. We've played the first half, which is first 9 holes. So we're about teeing off on hole 10 right now. You must be fit, you must have passion for the game. You must love the game of golf and love sport in general. Yes. We have par 3s, par 4s and par 5s. So par 3s are the shortest hole, and the par 5s are the longest. You come here very early in the morning, it's clean, you breathe in fresh air, so you can't take, there's nothing that beats it, you know, so everywhere is just clean. Golf is a game that exercises the whole body from your brain. You must be mentally alert, you must be physically fit, you know, so it's something that is all encompassing. Golf, when you've got all you need to play, like your clubs, like your trolley, who's gonna wheel your trolley for you? You need your caddy. Every successful golfer has got a caddy, and there he is.
Most of the times, if the players play bad, you as a caddy, you stand in a better position to calm the player, to make sure the player knows what he or she is playing. And as a caddy, if a player is counting his or her score, you must make sure that score is correct. We resume here most of the time 6 a.m. In most cases, we work every day, depending on how the players come. If they come, if there are many of them, most of the caddies work every day. If your boss is coming, you can caddy for your boss. But if your boss is not coming, you can caddy for anybody you feel like.
When we're talking about wellness and living, we're always focused on your health and the improvement of it. When you're healthy, when you're well, at any given time, you are presenting the best version of yourself. And once you start to take your wellness seriously, you are going to see that you begin to perform at optimal capacity at all levels. According to Rob Ulrich, a healthy outside must begin from a healthy inside. How are you ensuring that your wellness is growing progressively? How are you taking care of your inside? Today, our topic is Lassa fever. And Lassa fever is contracted from contaminated feces and urine of rodents. That shows that any healthy step, any healthy measure you ignore could be costly. Your good health is in your hands and is the best step you can take on any day, come rain, come shine. Continue to grow your wellness upwards. This has been Wellness and Living. Do spend time with us on our social media handle, Wellness and Living at Nigerian Television Authority. Thank you so much, everyone who has taken time to interact with us there. Continue to do so. Let's progress together. My name is Filma Obaze. I would love to do this again with you. For now, it's bye-bye.